Hi, everyone. Welcome. Thank you for joining us today. We'll get started just in a moment. All right. I see several folks have joined us today, so I'll go ahead and kick us off. Hi, everyone. I am Jenny Schitter. I'm the Director of Public Health Data for Big Cities Health Coalition. What is Big Cities Health Coalition? It is a forum for the leaders of America's largest metropolitan health departments to exchange strategies and jointly address issues to promote and protect the health and safety of more than 62 million people they serve. Together, these public health departments directly affect the health and well-being of about 1 in 5 Americans. You can see here our list of 36 member jurisdictions. Oop, not yet. Um, Sorry about that. That just popped up in my way. Okay. Uh, okay. Um, Next slide. Okay. BCHC focuses advocacy on several core issues, one being public health data modernization. We need more local data. Tracking trends at the local level helps us inform policy decisions and can identify those that are working and those that may not be. CDC has expanded its investment in data modernization at the local level, and we urge its commitment to continue through dedicated congressional funding and CDC engagement. We have been doing our own part to improve the access to local health data by creating a platform you will tour today. 3 decades ago, a group of epidemiologists created the Big Cities Health Inventory, or BCHI. They actually published chart books on a semi-regular basis to share information with their peers in other jurisdictions so they can benchmark health indicators. Back in 2015, with funding through CDC, BCHI relaunched the project as an online platform. And finally, in 2019, we partnered with the Urban Health Collaborative at Drexel University's Dornsife School of Public Health. The Urban Health Collaborative was created to leverage the power of data, research, education, and partnerships in order to make cities healthier, more equitable, and environmentally sustainable. The team at Drexel that you'll hear from today has managed the day-to-day work on this platform for over the last several years. Shortly, we'll discuss the new features on BCHI, which you can find at bigcitieshealthdata.org, and we'll drop the link in the chat, so feel free to open it up and follow along. But before we dive in, I do want to thank our partners whose support makes this project possible. The views expressed here do not necessarily reflect the views of CDC or our foundation funders. So with that, let's go ahead and jump in. So if any questions arise during our discussion today, please feel free to put it in the Q&A box, and we'll get to that later in the webinar. But I'd love to introduce Dr. Amy Auchincloss from the Drexel Urban Health Collaborative, and she'll pass the baton to the rest of the team as we move through the platform. So Amy, take it away.
Amy, you're on mute.
Sorry. Hi, my name is Amy Auchincloss. We're so excited that you're here and joining us today. We've seen some new faces and some older faces that have been part of the webinars before. So thank you. Thank you for taking the time. And I'm here with my colleague, Saima Niamatullah, who will be doing the demo. Thank you for offering your support by filling out the poll. This helps us understand who's here and whether you have much experience looking at the platform before. So I'm from the Urban Health Collaborative, which is a institute here at Drexel University that looks at urban health in cities across the nation and around the globe. And you can find out more about us at drexel.edu.uhc. So this work has been supported by 36 member cities. Thank you to all the cities and to all of you who are joining from these cities. We're so thrilled to have your collaboration over the years. And Atlanta recently joined us. We're so excited. City in the southern U.S., which has not been all that represented, although Charlotte, Mecklenburg County is as well. So we do not have today data for Atlanta, but we will be posting it in around August. I'll show the poll results. And do you see those on your end? Oh, there we are. Okay, great. So nice. 67% from local, municipal, metro, and also some state and NGO presence. Terrific. Thanks for filling that out. So I'm going to provide a brief overview on what's on the platform before we get started, but I don't want to take too much time, so I'll go fairly quickly. These slides will be available. Anyone who's registered will get a PDF of the slides. So if I go a little quickly, please look out on your email. So the platform has at this point over 125 metrics and over 250,000 data points. And the metrics are grouped into these 11 categories, and Simon will show you how to look at the list when you're on the site. For those who have used the platform, we're curious to know which features on the platform you've used. And Simon will be reviewing some of these, but it can help us to understand which parts have users. It's a little hard for us to figure that out from the Google Analytics. So metrics were chosen because of their public health relevance. Many of, or about half of the metrics were prioritized in the prior versions of BCHC's platforms that Jenny just mentioned. And the metrics align with CDC's Healthy People goals or they highlight demographic and socioeconomic disparities in health and healthy environments and or provide benchmarks for health department policy initiatives. So things that are unique about, well, maybe not, this is standard for platforms. The data are uniform and standardized across cities to allow for comparability. And mostly the sources are from federal and state sources because this allows us to harmonize and do things like age standardization. So compared to other platforms, some unique things about this platform, we have newer data than many other platforms. It's updated annually as the data sources release new data. We have 3 times as many metrics. We have city level data or census place for those of you who use census boundary, understand what that means. And many of the metrics have data for racial and ethnic subgroups as well as for trends over time, which is somewhat unique for this platform. So currently we have 2010 through 2024 of available data. So we just got, Saima just finished completing the 2024 upload. So we're excited to release that. And that includes, I know some users are looking for just even the census data at the city level, American Community Survey. Plus we have 25 other sources. And then the big files that take a long time to compile, the CDC natality files and the CDC mortality files at the city level. So again, this is city or place designated metrics. Just a reminder, we have some climate metrics. We always want to boost those. This is a unique feature of the platform. Climate disasters, heat wave season, this has been extended to 2024. Some new metrics, we added syphilis during pregnancy. That came from the natality file for years 2016 to 2024. This is annual. And some race and ethnic subgroup data for sexually transmitted infections, as well as some historic data for walkability, bikeability, and public transit. Details are in the technical documentation that Saima will be sharing shortly. Website improvements, we had some enhancements to the data download, which is a popular feature on the platform. Ease of navigation, you'll see there's some improvements on sorting or some flexibility. You can sort alpha by city name or by high-low value directly from the chart, not just from the top menu. And the metric search function, this has been a big improvement. This is a feature that Saima and I have really taken advantage of. You can just start typing into the search window and try to find the metric that you're looking for. Just a reminder that we rolled out last year and we have continued to update some data on Native American Alaska Native health, which is also a unique feature of the platform. And this was really instigated by members and by user requests. So we hope to be able to expand as the data expand availability. We hope to expand in that arena. So what are users doing with the data? The site's been visited over 180,000 times. We are always looking for new users though, so please spread the word. Data for community health assessment and other reports. This has been a popular use for these cities, populating the data dashboards. And in the PDF, you'll get, these are link outs to each of these sites that have used that. Policy and advocacy, firearm violence prevention, some legislation was using the findings from the platform in Maryland and Pennsylvania, and journalists are always using the platform. Do take a look while Saima will show you the tab where the What's New page. There's data summaries and some updates, so please do check that out when you get to the site. Yeah, so the just seeing what the great, yeah, 60% haven't used the platform. We're so glad we're doing these annual webinars because there's still many users out there that haven't used the data. Fabulous. This is great. Thanks so much for contributing to the polling. And we're off to the demo. Thanks in advance for Saima Niamatullah for taking the lead. She's the fabulous, irreplaceable data analyst from the beginning of our contract with BCHC. So we are, thank you for taking us through the demo.
Thank you, Amy. And thank you everyone for joining us for our walkthrough of the website. Let me start sharing my screen. Amy, please let me know if you have a problem seeing.
Okay. All good.
Great. So, yep, here we are. So this is the URL should be in the chat. So this is the homepage for the Big Cities Health Inventory. Since almost 70% hasn't used our data platform, I'll go slow so you can follow along. And please feel free to put any questions that you may have in the chat as we are moving along. Before I move to the walkthrough, I want to make some do some basic reminders, like in the FAQ. The first question we have is a link to the data technical documentation. So this in this document we have details about the metric definitions, the methodologies, and about the data sources, about how to cite the data, etc. So please take a look at it if you have any questions about the metrics Now going back to the site. If you want to contact us with your questions or suggestions, in the last question in the FAQ, we have a link to a survey form. So in this survey form, we ask some basic questions which are optional to answer. And you can give us your email address if you want us to get back to you. And I would like to reiterate that your email address is only used to communicate with you and it's not shared in any way. So you can leave us a suggestion or questions. As Amy mentioned, a lot of the changes or improvements to the website has been done in response to questions or suggestions from our users. So please leave your questions or suggestions if you have any. Now going back to the site. Okay, so this is the FAQ. And as Amy mentioned, we have a What's New page where updates are posted regarding the website. You can click on the subscribe button to subscribe for updates to receive updates to the platform. Now let's start with the walkthrough. So we have 4 different ways in which users can use to explore the data in our platform. One is Explore a Big City, which allows users to view the data for a single city. Compare Cities, which can be used to compare cities for multiple cities. Inequities, where users can view the racial inequities. And View a Metric, where users can view a single metric in details. Now let me go to Explore a Big City. So when you click, you have to choose the city for city of your choice. Right now, we have data for 35 of the 36 BCHC members. We are hoping to add data for Atlanta sometimes in August. So today I will choose Portland. So this is the city page for Portland. At the top, you see we have a little blurb giving some description and demographic information about the city. And below the blurb, we have the metric box. This, as you can see, this page populates with some pre-selected metrics. Right now, it's gun death and drug overdose deaths. You don't have to keep it that way. You can dismiss any metric by clicking on the cross here and add metrics by hitting the Add Metric button. You can add as many metrics to this page as you like. There's no limit to the number of metrics that can be added. So to select a metric, you can either select from the drop-down menu, or a better way is to view the whole metric list. So if you click on View a Metric List, you see the list of the over 125 metrics we have in our platform but this can be a little overwhelming. You can always filter by categories using this filter. So for example, if I want the syphilis and pregnancy metric, I can filter to the infectious disease, and under sexually transmitted disease, we have syphilis during pregnancy. So the chart renders. By default, the chart shows the time trend. Below the chart is a link to the data source and as well as the technical documentation. Below the heading is a subtitle, which gives a definition for the metric. As well, if you look at the upper right corner, there's a hamburger, which has some additional options like viewing in full screen, as well as downloading the chart images in different formats. And the download data allows users to download the chart data as a CSV format. Now, there are some options to make changes to the chart. So if you go up to the metric box again, using the group by, you can view data by for population subgroups. So for gun deaths, we have data for race, sex, and race and sex. If the population subgroup information is not there, these options will be grayed out. I'll select race. So this is the gun deaths by race for Portland. As you can see in the legend, when you hover over the label, it highlights the data for that particular group. And if you click on the label, you can dismiss the data for that group. In this case, this comes in handy because the overall population was overlapping and crowding the data for the white population. So This is really useful here. The races available for a metric depends on the data source. For data that comes from the vital statistics, we have data for Hispanic, white, Black, and Asian or Pacific Islanders. For data that are sourced from the American Community Survey, we have data for American Indians and Alaskan Native as well. Other option that you have to change the data is by selecting the years. So all years is the time trend. You can select any year to get a single year data view. A single year data are the bar charts. So this was viewing the data for a single city. You can add more metrics to see more data for your city. The most popular feature of our platform is the compare cities. So in order to compare the data from multiple cities, first you choose a primary city. I'll choose Portland. And cities for comparison can be chosen in multiple ways. You have the option to choose all cities. So those would be all the 35 BCHC cities, or 5 comparison cities, which is 5 cities which are similar to the primary city based on certain demographic and health characteristics. Or you can choose US total, which gives the national data, or any individual city. First, I will select all cities. Then you choose the metric. As Amy mentioned, we have this box is searchable by keywords. So if I want some sexually transmitted infection, just typing in STI will bring up the relevant metrics. So I'll choose syphilis during pregnancy. So this is the chart for all cities. Each bar represents the data for a city. On the y-axis are all the cities. We have our US total reference line, which gives the national value. If I go to the hamburger here, we have some additional options. That is, the sort is also included. By default, the cities are sorted alphabetically. If we click on high to low, so now the cities are ranked according to their values. If to put this data into context, you can also group the cities. In the first box here, we have the option to group cities by some city characteristics like region, poverty, population, or density, and segregation. I'll choose poverty. As you can see, the cities are now grouped with the less poor cities at the top and the poorest cities at the bottom. Now, in this page as well, you can view data for population subgroups and year trends, but these are grayed out here because these options are available only if 7 or fewer cities are selected. The eye icon gives users some information about the options they have for making their selections. And I will now go to another tab where I have already selected some cities and metrics. As you can see the chart to the left, the syphilis during pregnancy, this is a subgroup, is a subset of the chart we have seen previously. And on the right, I have the metric low birth weight. So if I click on the years, I have now the options to click on all years, which shows the data trend. And by clicking on the group by race, now I can view the data by race. In the comparison city page, when we group the data by race, all the races appear in different panels. So in the first panel, this is the data for the overall population. The second panel is the comparison of the data from multiple cities for the Hispanic population in those cities. The third, it is comparing the data for white population in the different cities, and so on. So Black, white, Asian or Pacific Islander, and here we have data for American Indian and Alaskan Natives as well. On the right, the bottom of the page, you can see a red back to the top button. When I click on it, it takes me back to the metric search box. As well as in the Explore a Big City page, I can add more metrics to this page, and there is no limit. Another unique feature of our platform is the ability to see inequities. That is the difference, or the ethnic and racial and ethnic inequities to understand the difference between the groups. So in the inequities, first I'll select metric. I'll bring up the list again. I'll select walking to work. And I have to select a city. I'll select Portland. The inequities are expressed in terms of absolute difference in rate. This chart is a little different. In the center, you see the axis is at 0, and inequities can have both negative and positive values. Each bar represents the absolute difference in rate between a minority group and the white population. So the blue bar is the black-white difference. The green is Hispanic white difference, the pink is Asian white difference, and the purple is the American Indian Alaskan Native white difference. If you hover over the bar, it gives a little explanation. For example, compared to white persons, black persons have 1.09 percentage points higher walking to work. So the difference is black 5.11 minus white 4.02. So these bars represent the absolute difference in rate between the minority minus a white group. You can also view the inequities for all the cities at once by clicking on the all cities, in which case the different races are visualized in different panels. So here as well, if you hover over the bar, you get a little explanation. The fourth option to visualize the data is view a metric, which is viewing a single metric in details, but I will not get into that right now in the interest of time. What I do want to mention the different ways you can use the data in our platform. One is to share the link. Our links are pretty stable. So if you share the link in a presentation or report, it should be active for a very long time. As I've shown before, you can download the image or the chart data using the hamburger for every chart. You can also download all the data in our platform in bulk. That is using the download page. The link is at the bottom of the page. At the bottom navigation bar, we have a download. We have the download option, and I click on it. So you have to agree to the terms and conditions. Only the email field is required. Everything else is optional. And when I agree to the terms and submit, so this is the download page. Here you have the option to download all the data in our platform, or you can filter the data to a city or metric or year of your choice. So, and the download format is the file is downloaded as a CSV. So for the metric, I can either select all metric or individual metric. I can select an individual city, and the same with year, and hitting download will download the data as a CSV, and no further permission is required for that. So that is all from me. I will thank you. I hope you have fun playing around with the data platform. I'll pass it on to Amy.
Sorry. Thanks so much, Saima. Beautiful job. And I will share. We have one more question about how you think you might be using the data. That's helpful to us. Thanks. And questions or comments, please add them. I see a bunch of folks have already added them to the chat. That's very helpful. We'll get started on some of those, as well as there were some questions that were submitted during registration. And this is the site if you wanted to look at it on your phone or take the QR code. And I will pass the mic to Kate.
All right.
Donaldson.
Thank you, Amy and Saima. Really appreciate the overview and the demo. So as Amy noted, we will open this up now for questions. So please use the Q&A Q&A function at the bottom of the screen. So you might have to hit the more ... button to be able to access that. But that way we can track the questions that are coming in. So while people are posting those, let me go ahead and start. There were a few questions, Amy, Saima, that came in as part of the registration for the webinar. So one is, how can we integrate these with our website and dashboards, or create city-specific dashboards from the data inventory? And so Amy, I'll turn that over to you.
Sure. Yeah, a few cities have. Long Beach was a pioneer in this, and they added, so they downloaded the data, the main, all the data that we have, which is in the download link that Saima demoed, and then saved that and then imported it into their function. I think that their platform maybe used ArcGIS as some kind of a pass-through, but then ultimately they were developing something in Tableau that was creating a data dashboard. So a few sites have done that, actually, have either hard-coded, most of them have hard-coded the data just from a download. There is, we can make available the API for users that have preference for that. Just to note, our data are not updated, like the API isn't all that useful in this case because the data are not updated that frequently. So it's really just the spring update that we're sharing now. And then there might be, as Simon mentioned, Atlanta will also get added at some point, August, September. So yeah, any other questions on that?
Yeah, I think there were a few follow-ups, Amy. It just talks about
Okay.
city-specific dashboard integrated. So I think you answered that with the download piece and the API and some integrations. But if anybody has additional questions about how to make that happen, please follow up, and we'll be glad to get into that in detail to help create those. So
Yeah.
and then Simon, I'm going to ask some data-specific questions for you. So I'll start with one, but then there's a few that are related. So first, can you clarify what the source of the data is that's used in the dashboard?
It's so we use primarily federal sources. Let me just share my screen once again. So in the technical documentation, if you go to data sources, we have some at the table which lists out all the sources of data, as well the years of data that we have incorporated in our platform. So most of these are federal sources, but most are the primary criteria that they need to have. These sources need to provide data at the city level, and these sources have data for most of our, at least 70% of our cities. So these are the data sources. And like I mentioned, I see some questions in the chat that also pertains to the comparison cities. That you can also find the details about how we classify, how we grouped the cities or selected the cities for comparison cities if you go to the city classification. So here we have some details about the selection of cities for this criteria for the cities to be selected as a comparison city to the primary cities. So this technical documentation should have a lot of answers to the questions related to data.
Great. Thank you, Saima. Continuing on that, let's talk about your race ethnicity data. So can you further clarify about white, Black, and then non-Hispanic, as in, are those mutually exclusive or overlapping categories, and how does the inventory classify them?
Great question. So we were limited by the availability of data from the data sources when we were classifying the race and ethnicity. So all the metrics doesn't have the same categorization for the race and ethnicity. So if I share my screen again, so back to the technical documentation. Okay, you can see my screen, Amy?
Yeah. Yeah.
Great. Okay, so here we have, yes, we have the race and ethnicity. So this lists out the exact groups that are included or excluded when we categorized the race for metrics from these different sources. As you can see, we had a uniform label in the interest of the presentation of the platform, but the groups vary a little by depending on the data source from which we get their data. I hope that answers your question.
Yes, thank you. I think a couple of the questions that I see in the QA will also, I think, tee up nicely for the subsequent webinar we intend to have this summer. So I will go ahead and put it here, but also note that might be a topic for future conversation. Can you talk about, in general, who is the ideal target audience for the data inventory? Do we see that community-based organizations or grassroots organizers may use this platform? And if so, do you have any examples of that?
The target audience are the main target audience are the members, because it's the 36 cities that are members of the BCHC. But yeah, there's a variety of other users, particularly community groups, legislative aides, policymakers, journalists in local newspapers, universities even in these cities that are using the data as well. So yeah, I mean, hopefully our platform it's rich. There's a lot going on. There's a lot of tools that one can use, but hopefully it's fairly intuitive and there's good visuals. So ideally, it does have broad applicability to community uses and just trying to get a quick look at where one city stands relative to other cities, or just to grab some data for your own city. I know that many cities or community groups are looking for local neighborhood level data, sub-city level data. That is not on our platform. We only have the city unit. One of the questions also came in as county data available. Our priority was city, but there are some sources that city actually is not available. So there is county data. The STIs, actually, most of that data are county level data. And then we have some air pollution and the heat metrics. Those are, as you can imagine, ambient readings that are a larger geography than just the city. But we ideally we're looking for city data.
Great. And Amy, do you want to give a quick teaser for the upcoming webinar, building on, who's using the platform, our audience, and just love to encourage people to join us later this.
Yeah, please look out for there'll be an announcement via the BCHC. We'll be sending out an announcement for that in July. We're going to have another webinar similar to one that we had in last year, which you'll find on our What's New page. There's a recording of that webinar. San Antonio, Charlotte, Philadelphia, and Long Beach participated in the last July's webinar. We were very grateful for it. It was a great demo. So yeah, they were describing ways that they're using the data, and all of them kind of different. Some were doing data downloads and platform in using it for their own data dashboard. Other folks were just using it on a daily basis, almost just checking in with before going into a meeting, what other cities are having similar issues to their own city. So yeah, please look out for that. We're looking forward to hosting that.
Great. All right. It looks like I see one more question that we can take here. And if anybody else has any lingering questions, please feel free to get them dropped in the Q&A. But this is looking more at the social determinants of health data and just, what has been most valuable to member cities. Have you had any feedback on that section and just how's it been utilized?
Sorry, I was reading sorry, I was reading one of the other chats. Could you say this again?
Yeah, for sure. Which social determinants of health
Oh,
variables have been the most valuable to users of the platform?
I mean, I think it's some of the race group data, unfortunately, is very socially determined in the US. So some of the very extreme disparities in that, just even some basic census data on college metrics, college education, but it's probably more the things around mortality, natality data. Um, and yeah, so social determinants of health. I mean, some of you already have access to the poverty metrics, but we expanded a little further. There's a racial segregation, there's income inequality metrics, and then the tab itself that is able to highlight some of the inequalities. We're seeing in the chat some requests around contrasts in the inequalities tab that's not just using white as the referent group, essentially. Not, referent is really the wrong way, but the measures, the differences were taken from white versus other race ethnic groups. I think it's just there's a lot of overload if we have all the different race ethnic comparisons and look at those differences and have that all available visually is too much. But users, please do take advantage of the data download because that's all available to you, and you can actually just calculate those differences on your own once you just download the data, and it's downloaded into a CSV. It's not complicated. And if you have any questions about that and wondering how to download or how to filter and how to make more sense of the data, please contact us. We definitely want to help users make it accessible and make it useful to you.
All right. Not seeing any additional questions, but also thank you very much to those in the chat for your feedback on the dashboard itself, how you've used it, and recommending it to other colleagues here that are participating in the webinar. We really appreciate it. Thank you again to Amy and Saima for providing the overview, maintaining this dashboard, and always supporting our member cities and the data work that they're doing. So thank you again for attending, and we hope to see you at our upcoming webinar this summer to dive into more details of the utilization of the dashboard. Thank you all.